we can see that in optimal care, we have an expensive drug such as SGF, the GLP-1 receptor analogs, and we have even SGLT inhibitors, whereas if both for renal disease and cardiovascular disease. And then if you basic care, we can go for metformin, and SGLT inhibitors will do the job. So indicating that we don't need to go only for most expensive therapies. If they can afford, they can do that, optimal care. But for a basic care, if you look into that, we have options as a low cost therapies that are available at metformin and SGLT inhibitor. Now, never, whatever therapies that you use, you need to have lifestyle modification. And all persons with the type 2 diabetes, they have to do at least about half an hour walking or do some exercise. And the most important thing is that it's not an easy implementation, but we can see that it is a 5 to 10% reduction in body weight will enhance the quality of life, reduce all-cause mortality, and lower rates of hospitalization, reduce healthcare costs. So this is what we need to aim. This is one of the solutions that we can think about. And even Rssdi recommendations, if you look into that, I recommend all of you to go to the website Rssdi clinical to the Rssdi, and look into the Rssdi clinical practice recommendations and management, which is being updated this year, and this is from 2022. You could see that recommendation says that moderate calorie restriction and also having a good exercise pattern every day, and then change the dietary composition to low calorie diet, combination of aerobic and resistance training exercise. Now, why resistance exercise is because as they grow older in diabetes, there is a sarcopenia that can happen, so that we need to replace it more protein and do some resistance apart from aerobic exercise, and change in behavioral pattern. Now, this is not just that, and what we have to see that we should have also suggest them to have a good sleep, because nowadays that sleep patterns are so bad. I think a lot of people say that the spouse will complain that she or he is seeing the mobile phone and what throughout the night, and he says that I am not able to get sleep, that's why I am seeing. And the other person says that no, he's seeing, that's why he's not getting sleep. I think we need to look into the sleep pattern is very, very important. As I said, that strengthening exercise, the extra protein is also a very good idea to do that. Just asking them to do exercise is not enough. A part of it, they should have some resistance exercise itself. Now, what is happening in our country? This is a landmark trial which they followed for 3 years. I am just talking about, this is part of the problem all over the country, but I am just limiting to the South India, where about 135 sites, that includes Bangalore, Chennai, Coimbatore, Hyderabad, Kerala, Vijayawada, and about 2,354 participants, and they just followed it up with the standard care. HbA1c has come down from 8.1 to 7.5 in 3 years, and blood sugars are come down both fasting and postprandial, but still wanting. So I think it also says that we need to do more to get a better control of diabetes. There is some improvement, there is no doubt about that. Now, why is this happening? This issue is happening mainly because we are not able to come under control. And if you remember that I said that the average HbA1c is 8.9 in our country. And what you can see that basically what we need to look into this is that instead of going for stepwise therapy, you need to be proactive and start the combination therapy, appropriate combination therapy from the beginning, so that we can achieve better diabetes control, and which has been a big challenge so far. This is only simple thing. It's a very simple thing. Go for a combination therapy, appropriate combination therapy, so that we get a better control of diabetes as well. And don't hesitate to start insulin when you are unable to control diabetes with three molecules. So this is another thing that is happening. There is definitely the intensification of both oral drugs and as well as insulin is not there. It is said that about insulin therapy started more than 7 years delayed, until the HbA1c is more than 9, and which you should not do that. And I think these are the things that as healthcare professionals, we need to adopt as a solution to have challenges that we are facing. Now, the next challenge that we are facing, the future, is going to be the obesity. You can see that obesity is now a global epidemic, and it's an obesity crisis, and then we are not far away from other countries. And if you can see that the National Family Health Survey within 4 years, we could see that there is an increase from the overweight and obesity amongst women from 20% to 24%, and in men from 19% to 23%. So there is about 4% increase in just 4 years. And apart from that, it's a big problem that we are facing is that abdominal obesity. 40% of the women and 12% of the men are abdominal obese in our country. This is typical Indian phenotype. And 49% of the women in age group of 30 to 39 and 56% of the women in the age group of 40 and 49 and cross a cut-off mark, and their BMI is not very bad at all. Just 23, but abdominal obesity is very, very high. This is an Indian survey. Now, look into the state-wise, that we could see that Tamil Nadu is leading for obesity and overweight, and along with Punjab and Pondicherry and Andhra Pradesh. These are the states as of now who are having the maximum obesity. And what I would like to see is that those states which had the least obesity in about 9 years back, like Orissa, and then if you can see that the northeastern states, you could see that the phenomenal increase is being there for obesity and overweight. You could see that. The reason is that the penalty you pay for development and industrialization. Okay. So it looks like that. I mean, in fact, Tamil Nadu and Andhra Pradesh and Pondicherry and Punjab happened, but it is also increasing from 36 to 44 today. And this is not, but this is a data about 4 years ago. I think this is a big challenge that we are going to face, and then we need to look into that. And then you can see that the expenses, the moment you have overweight and obesity, the expenses, there is a significant increase in Medicare expenditure. And then look into the GDP, we are spending about 0.8% of the GDP in India towards medicine, and then it is supposed to increase to 2.42% in shortly, with the obesity and the overweight trend is going up like what is seen. But look at this, and if you have any effort that you give to reduce the healthcare costs, you can see that the healthcare also will come down. Now, the another problem what we are facing is that apart from having the elderly people who are not that obese or overweight, but the young generation, the younger people, and also the adolescents are having a huge amount of increase in overweight, and this is what even in the National Family Health Survey says. So there is a call for action. We need to implement school-based interventions, promote active lifestyles, target awareness and awareness campaigns. In fact, it's very dangerous to know that the obesity amongst the children less than 5 years was just 0.5 about 6 years ago. Today it's 3%. So this is about 6 times increase in obesity amongst even children less than 5 years. And this is what in the future is going to be more bleak unless we take care. Now, what are the recommendations that we can have to look into this is that the multi-sectorial collaboration, urban health planning, and parental involvement. Now, this is one example for adolescents especially. Then what we can do, if we can educate them to do more physical activity and reduce the calories and reduce the body weight, and this is a program which is done in Greek. What they have found is that they put them on Mediterranean. Mediterranean diet is nothing but less fat and all, but we don't need to observe that. We need to cut down calories and fat that have to be done, and increase the physical activity level, improve the sleeping hours. Look at this, improving the sleeping hours and sedentary activities, and there is a significant decrease in the total and central obesity in both genders in adolescents. This is what we can do for that. So we have to go for all these things actually. So I think this is most important thing is that our children and grandchildren should know about that, and we need to implement these issues in the beginning itself. Otherwise they'll be landing up at a very early age into diabetes and other comorbid conditions. Now, I was involved in a community service itself, and I would like to spend 2 or 3 minutes on this because what is it we can do at a community level? and it is possible. And I'm not trying to say that if you don't go for community service, but at least part of your time if you can spend for community service, I think we'll be doing a lot of good for our society. And I worked at VHS Medical, that is Voluntary Health Services Diabetes Department, for almost 20 years. More than 25 years I spent with the legendary Dr. C.V. Krishnaswamy as the head of it. And we used to take care of about 800 children with type 1 diabetes. And then we have seen the improvement. We used to give free medication, insulins, and probably the first institute to give insulin in our country for children with diabetes, type 1 diabetes. And then we have created several welfare schemes for them actually, so giving soft loans to them so that they can stand on their lines. And we have seen a very, very great reduction in morbidity and mortality. But this also seen that there are so many social aspects. I think in spite of giving so much of support to these type 1 children, when we looked into the mortality, the first cause for mortality has been infections in those days. I'm talking about 25 years ago. And then the second common is suicides. You know whom? Only girls, not men. The problem with this is that social problem is that the parents want to push the girl with type 1 diabetes away from home and concealing the fact that they had type 1 diabetes, and they get married and then they go into marital disharmony and then take an extreme step. This is in spite of you supporting it. This is the fact of life. So that is one thing that we have learned, that and institutionally a service to the type 1 diabetes is a very, very important thing to prevent complications of for the young children who are suffering from type 1 diabetes. And I'm also involved in the last 12 years or so. I was with, we started a free diabetes clinic every Tuesday, and we see about 300 patients with the help of some of our friends like Dr. Kannan, Dr. Sellapandi, and then Dr. R.P. Rajesh and Mohan, and also late Dr. M. Chalamariappan. He passed away about a month ago. So we used to have, and then it is very heartening. In fact, we give free medications for the whole. In fact, we have started giving for 2 months, who's under very good control. So we are able to give that, and we are able to get the medications including insulin at a lower cost. So what I am trying to say is that if we can spend some extra time, we can do so many good, especially for the poor people who are unable to afford even the small amount of money